My name is Mark Smith. I'm an occupational therapist, and I'm the president of the National Federation of Federal Employees, Local 1, representing frontline healthcare workers at the Veterans Health Administration here in San Francisco. I'm proud to stand with you all here today in the struggle for a national single-payer healthcare system. At the VA, I see firsthand every day what healthcare looks like when we collectively decide to put patients over profits. While it's not perfect, obviously, no system is, the VA delivers comprehensive, publicly funded health care for over 9 million veterans and their families every day. And despite what you might have heard from the corporate media, the care is world-class. Study after study shows that VA-delivered health care either matches or outperforms the private sector health care in both quality and patient satisfaction, and at significantly lower cost to the taxpayer. Last year, veterans' trust in the VA was the highest it's ever been recorded. But the corporate healthcare industry, our friends over at United Healthcare, and the private equity ghouls who back them, and the politicians that they've bought and paid for, hate this. They hate the VA, this model of publicly funded healthcare, right? Because it's hard to make a profit selling the idea that public healthcare doesn't work when the VA keeps inconveniently proving that public healthcare does work, right? So the corporate class is running the same playbook that with VA that they run with all of our public goods and services. They want to defund VA healthcare by siphoning off resources to the public sector under the guise of choice, right? We've seen this with public education. We've seen this with our postal service. We've seen this with all kinds of public goods and services. And then, they degrade the services, and then they demonize the understaffed and under-resourced facilities as inefficient, right? This is all with the ultimate goal of dismantling the system so you can sell it off piece by piece for a profit. So why does this matter? Why do we care? What do we lose when we lose VA healthcare as a publicly funded good? Obviously, for the millions of veterans who depend on that healthcare because they couldn't otherwise afford to pay for it, they stand to lose that healthcare. But we also risk losing the public goods and services that VA provides that benefit all Americans. The VA trains thousands of healthcare professionals every single day who then go on to serve civilian communities. 70% of American physicians do at least one rotation at the VA during their training. The VA's publicly funded research program develops treatments that we all benefit from. The implantable pacemaker, the liver transplant, the nicotine patch, the CAT scan, the list goes on. VA has had a hand in many of these innovations that we all benefit from. And many folks don't know this, but the fourth mission of the VA is to back up the civilian healthcare system during times of national emergency. So we saw this most recently with the COVID pandemic. VA provided medical support and emergency services in 38 states during the COVID pandemic when the private sector healthcare system was overwhelmed. No private system is going to provide all of these functions because they don't generate profits. But most of all, if we lose the VA, we lose one of the best functioning models we have in this country of a publicly funded healthcare system. And we're all here today, presumably, because we share the belief that healthcare should serve people and not shareholders. But a belief is not enough. Did working class veterans get publicly funded VA healthcare benefits because they asked nicely? No. Veterans got VA healthcare because they fought tooth and nail for it for decades. So we need to do that as well. We need to fight for the VA. We need to fight for Medicare. We need to fight for Medicaid to defend what we've already got. And we need to fight to expand for Medicare for all, for a national single-payer healthcare system. And we need to fight for healthcare as a human right, for veterans, for workers, for everyone in this country. Thank you. Solidarity.